You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today joins me from Sydney in Australia. His name is Neal, and he's the Director of Research and Development at BioCeuticals. Neal, welcome to Health Professional Radio.
Oh, thanks, Wayne.
Now, Neal, BioCeuticals is a product name, but or a category name and a company name. I guess that we're talking about a particular range of substances and formulations. I understand that in your case, these are practitioner only.
Yeah, that's correct. BioCeuticals, we're Australia's leading provider of practitioner-only nutritional and therapeutic supplements. So we sell kind of natural medicine to healthcare practitioners for their review and recommendation to their patients.
I see. And Neal, when you say practitioners, is that medical doctors only, or does that include other health professionals?
Yeah, no, that's a good question. It certainly includes medical doctors, but we sell our products to pharmacists, to naturopaths, to chiropractors, physiotherapists, herbalists, and even traditional Chinese medicine practitioners. Really, any individual, a healthcare practitioner individual. And the reason why we do that really is because we feel that they're very well placed to be able to piece together and understand the evidence base supporting our particular formulations and natural medicine in general to determine what's right for their patients.
Yeah, I think that's a very important question, is that just because a product's available on the shelf doesn't mean it's harmless or useful without some professional advice to go around it.
That's exactly true. And, I think particularly when products do have specific uses, it's very important to understand kind of how they can be used, what to watch out for. Some of them can have contraindications, or they can even be synergistic to some pharmaceutical interventions. And so in some cases, and depending on kind of what they're trying to treat, it's really important to have some practitioner guidance and recommendation.
Neal, the thing that I really wanted to talk to you about today was the research you've been doing, because in your role as Director of Research and Development at BioCeuticals, it's come to our attention that there's been quite a significant trial reach publication point. Can you tell us about that? Yeah, well,
exactly. So, obviously for us, it's really important that we further the evidence base supporting natural medicine. And we've recently launched a new patented product, and that's called Cognition Support. And it utilizes clinically trialed ingredients, so ingredients that have been clinically trialed individually. So we've got Bacopa in there, which is an Ayurvedic herb, and that's been standardized. We also have ginkgo biloba as well, which is standardized in addition. There have been some clinical trials done on that particular extract. And we have ginseng in addition to that, Korean ginseng, which has been standardized to ginsenosides. But we've also included a nutrient in there, which is kind of the novel step, and that's alpha-lipoic acid. And we've had a good relationship with NICM and the National Institute of Complementary Medicine at the University of Western Sydney. They do some fabulous work in terms of research on nutritional medicines. And so we've partnered with them to co-fund a PhD candidate to study this formulation. It'll be a 3-year trial utilizing the product as well as a placebo, and that's going to be looking at mild cognitive impairment in elderly individuals, which is something that we feel is kind of becoming a real issue.
Many of our audience are practitioners of one kind or another, both in acute care and in aged care, and MCI, which would be something that those in aged care are very familiar with. This is generally now, I think, accepted as a precursor almost to dementia.
Yeah, that's exactly true. We estimate that up to 35% of Australians who are over 70 years of age have a mild cognitive impairment. And then, just as you point out, up to 15% of those will go on to develop dementia within a year.
Yeah, that's an extraordinary statistic, isn't it? That's a very high number of people.
It is.
Not enjoying their aging years as well as they should.
Yeah, exactly. Well, we know early intervention can slow the progression and course as well. So, and that's what we're trying to really determine whether or not this formula can help in any way, which could provide a great deal of value in terms of extending quality of life with those individuals.
You're listening to Health Professional Radio with Wayne Bucklar, and I'm in conversation with Neal Mercado, Director of Research and Development at BioCeuticals, and we've been talking about a PhD study that's been undertaken to look at the impact of a patented, I guess we'd call it a supplement, a patented natural medicine, and its impact on mild cognitive impairment. Neal, is it your expectation that this will be a double-blind placebo test that'll withstand all the scrutiny and criticism about research?
Yeah, absolutely. It has to be. There's no sense in doing research if we're not doing a double-blind placebo-controlled trial. We do expect to publish that in a peer-reviewed journal as well. And really, we don't know what the findings are going to be. We're very hopeful and we're confident that they're going to be successful based on the formulation that we have and the previous research done. But this is all about doing good research and publishing the results. So we'll publish no matter what. If we get a trend, if we get a negative, or if we get a positive, it's important to us. We feel that any result will further the understanding and the research, in this area.
That idea of publishing research in peer-reviewed journals is kind of, I guess, automatic in many disciplines, but it's not new, but less common in the complementary medicine sector. And from time to time, I do talk to people who are critical of complementary medicines because they don't have an evidence base and they're critical of the research stuff. Now, when you say this will be a double-blind placebo-controlled test and published in a peer-reviewed journal, there is no better scientific evidence than that at this point in time, is there?
There is some very good evidence, as I mentioned, kind of on individual herbs that we have. So there's some really good published data on ginseng. And in fact, our parent company, Blackmore's, did a trial on ginseng, on the very ginseng extract that we're using with Swinburne University, and had some very good results in terms of its benefits to kind of improving mental capacity and working memory. And in fact, the bacopa that we use, which is that Ayurvedic herb, that's had a clinical trial published on it for verbal attention, verbal memory, and memory acquisition as well in the elderly. So there are a lot of trials. Usually they study kind of individual interventions, single herbal interventions. There aren't that many that utilize a formulation such as this. So this is going to be a little bit new territory, but there already is some good evidence, sound published data in peer-reviewed journals supporting the use of the individual herbs.
Well, we'll look forward, Neal, to being able to get you back to tell us the results of that study when it's completed.
Yeah, I'm very much looking forward to that, Wayne.
Now, in the meantime, anyone who's looking for more information from you, Neal, I guess the best spot is the website, www.bioceuticals.com.au?
Yeah, that's correct. Or they can also head over to www.nicm.edu.au, which is the website of the National Institute of Complementary Medicine. And also, I think, too, to see some of the good work that they're doing some fabulous evidence-based work in a whole range of nutritional interventions. But I'd say those probably cover it.
Neal, it's been a pleasure having you with us. Thanks for giving up your time today. I realise you're a busy man, and we do appreciate you taking the time to chat with us on Health Professional Radio.
No worries, Wayne. Thank you so much for the opportunity, and I hope you have a great day.
Thank you very much. If you've missed my conversation with Neal Mercado, Director of Research and Development at BioCeuticals, the good news is there is a transcript on our website. There's also an audio archive of this interview on both SoundCloud and on YouTube, and you can also find links to those on our website. That's at www.hpr.fm. My name is Wayne Bucklar, and you're listening to Health Professional Radio.